Welcome back to the urinary system. All right, let's take a quick look of what can go wrong. Now, and I should have said this earlier if I didn't, we're only doing small subsets of things that can go wrong with our bodies. You will learn a lot more about this when you get into the program that you are interested in going into. However, these are the sort of like the big ones, the most common ones that can go wrong with some of these systems. Well, first of all, you may end up having glucose in urine, right? Usually this is going to be due to diabetes because there's so much blood sugar that those transporters are at their maximum and there's still more sugar to reabsorb. So you can kind of see this. So your symporters cannot reabsorb sugar fast enough or glucose fast enough if it is above 200 milligrams per milliliter, right? So that causes glucose to remain in the urine. The fancy word for that is glucosuria. And we can measure this using something called a multi-sticks. You'll see this in lab as well. These multi-sticks measure for 10 different things in the urine. They're very quick. You just sort of dip them in the urine. You look at the color, see if there's any indication of certain things being present that shouldn't be there. It's very, very important to conserve water. I mean, just take a look at this. The amount of urine being filtered by your nephrons exceeds the total blood volume in half an hour. If we did not conserve any of our water, we would be constantly drinking water. Like we wouldn't be able, like we'd be hooked up to, we'd be fish, right? We'd have to be in fresh water, constantly absorbing drinking water. Okay, I mean, these numbers are absolutely phenomenal to me. In a normal day, look at this. We filter about 180 liters of fluid a day. That is 180, not 18, not 80, 180. Crazy amount. And we excrete about 1 to 2 liters of urine a day. That's amazing that we can reabsorb that much after having filtered that much. Very efficient. Our kidneys are amazingly efficient if they're functioning correctly, right? And obviously these numbers will depend on how much you drink and, it might be less or more depending on how hydrated you are. But again, super important that we can try to reabsorb water, right? So let me just give you another concept here. And especially right now in the summer, as we're talking here, and as I'm recording this lecture on a very hot summer day, we normally see temperatures going up to 113 degrees, right? I mean, look at this. If we were out in that temperature, and I don't mean in the like if you're out walking around, not in shade, you lose body mass very quickly due to perspiration, right? So in about an hour, you have lost about 2% of your body mass in water, right? At about 2 hours, you've lost 4% of your body mass. Now, right around here at this 2-hour mark and this 4%, I should say this 4% of body mass water loss is where people really start feeling like they're starting to really feel the effects. So this is usually when we have people from out of town coming to hike. They're hiking out in the middle of the day for some Lord knows why reason. And at about 2 hours in, they're like, I'm not feeling so great. I'm kind of done. I'm tired. Like they're starting to feel the effects. So they want to turn around and go back to their cars. But here's the deal. If you've hiked 2 hours out, guess what? You got to hike 2 hours back usually, right? At about 4 hours, you've now lost double that. So you've lost about 8% of your body mass. And at this point, you're actually actively confused. So this is where you'll often hear about people like they turned around, they didn't want to hike anymore, and then they find them like off the path somewhere, even though they're really close to the parking line. You're like, what happened? How come you didn't just keep walking in a straight line? Well, it's because they're starting to hallucinate. They're getting very, very disoriented and confused. And another hour later, if they're not found quickly enough, at this point, their tongue is swelling. That like they're really So they're starting to come in and out of consciousness. Another hour after that, you can't even if you found them at this point, they're not even able to drink water. Their tongue is swollen so much you have to give them intravenous fluids, IV fluids, and sometimes they're not even conscious at this point. And then any point after that, at about 15% body mass loss, people pass away. There's not enough water to help thermoregulate their bodies anymore. Their temperatures spike. They suffer brain damage, and they pass away. So again, very important that we can conserve water, because if we didn't have this mechanism, not only again would we have to constantly drink water throughout a day, but we wouldn't even be able to tolerate any kind of water loss. And since that's our main way of keeping cool, really important that we can at least reabsorb some of the water in our bodies, so that it gives us a better chance of survival on hot summer days, especially here in the valley. Now, you may have heard of dialysis. This is treatment for people whose kidneys are failing. The idea here is that as kidneys are failing, they can no longer adequately filter blood, so you have to have an external mechanism that filters your blood for you and puts it back into your system. So that's what you're seeing here. There's a dialysis machine that will filter the blood and then put back the clean blood into the person. There's two main types of dialysis. The first is this hemodialysis. That's sort of what you're seeing up in this upper image. This is usually where someone has to go into the hospital or a treatment facility, and they're hooked up to a machine. It usually takes a couple of hours to cycle through, clean the blood, and then people can go home. This, usually somewhere around 3 times a week. So it's very, I would say, invasive to the extent that you need to go in somewhere 3 times a week for 3 to 5 hours. That becomes part of your life, right? There is something called peritoneal dialysis, and that's what you're seeing here. So where basically a bag of solution is pumped into the peritoneal cavity, and because there's lots of blood vessels in our digestive system, they will actually, through osmosis, they will kind of more slowly filter waste into this fluid. Like I said in this image here, those waste products are then, removed into a drainage bag. Right. This can usually be done at home with fewer trips to the hospital. Now, obviously, it's going to be less comfortable for individuals as their abdominal cavity is pumped full of fluids, as you can imagine. But again, it just depends on, a certain level of kidney failure, what an individual can tolerate, how well other portions of their body are also functioning, whether or not they can tolerate, which procedure might make more sense for them. All right, so that is going to wrap up the urinary system. And as always, if you have any questions, please let me know.